All right, everyone, get ready, because today we are going deep, really deep into the world of hypertrophic cardiomyopathy, HCM for short.
That's right. We've got a mountain of articles here, so obviously someone wants us to
Dig up all the juicy details on HCM. And it's a good thing we're doing this deep dive because
more common than you might think.
way more common. So before we get lost in the jargon, let's simplify.
Good idea.
When we talk about HCM, we're really talking about a thickening of the heart muscle, right?
Exactly. The heart is like a house, and HCM is what happens when walls get replaced with like super thick concrete. The heart muscle, especially that main pumping chamber, the left ventricle, it gets too buff.
Too much of a good thing, huh? So it's like trying to pump water through a straw that's slowly closing in.
Perfect analogy. And it's that thickening that makes it tough for the heart to do its job right. Now, here's where it gets a little more complex.
More complex.
Don't worry, it's not too bad. There are different types. We've got obstructive HCM, where the thickened muscle actually blocks blood flow out of the heart.
Like a door that's stuck halfway open.
Exactly. Then there's non-obstructive HCM, muscles still thick, but no blockage, pumping still harder, just not as bad as with the obstructive kind.
Okay, so two different ways it can play out. But what about symptoms? What should we be looking out for?
This is where HCM can be a bit of a chameleon.
A chameleon, huh?
Yeah, symptoms are all over the map. Some people, especially early on, they feel fine, nothing. Others, only during exercise. And then there are those who have symptoms even when they're just chilling.
Wait, so you could have this heart condition and not even know it? Yikes.
That's why we're here.
Yeah.
Early detection is key. And from what I see in these articles, we're talking chest pain, shortness of breath, fatigue, the usual suspects.
Those are pretty general, though, right? Couldn't that be a bunch of things?
Absolutely, which is why HCM is often misdiagnosed. Get this in kids, it can even look like asthma.
Oh, seriously? I would never have guessed that. Okay, that's a bit scary. But what actually causes this thickening in the first place?
Most of the time, it's genetics. Family history is huge here.
So if your grandma had it, you're more likely to.
Exactly. But, and this is important, just because you carry the gene, it doesn't mean you're guaranteed to get HCM.
So it's not an automatic sentence. Phew, that's a relief.
Not at all. We're still trying to figure out why some people with the gene develop HCM and others don't. Science is always evolving.
Always more to discover, that's for sure. But besides genetics, what else increases the risk?
Well, while genes are the main culprit, high blood pressure and just getting older can play a role. Not as common, but worth noting.
Interesting. So family history is clearly a big factor, but let's say someone, maybe they're listening right now and they're thinking, that sounds familiar. What's the first step? How do you actually find out if you have HCM?
Talk to your doctor. They'll take your medical history, ask about any family history of heart issues. And
this is where knowing your family tree really pays off.
you got it. But after the initial chat, the tests come in. And the gold standard for diagnosing HCM is an echocardiogram, an echo for short.
An echo. That sounds familiar. Is that like an ultrasound for your heart?
Exactly. Sound waves create pictures of your heart,
Yeah.
showing how well it's pumping, if there's any blockage, the whole 9 yards.
Wow, technology is amazing. So the echo shows if the heart muscle is too thick, if there's obstruction, a real eye-opener. But are there other tests too?
Oh, absolutely. Your doctor might also recommend an electrocardiogram, or ECG.
ECG.
It measures the heart's electrical activity. And sometimes, for a super detailed look, they'll do a cardiac MRI or even genetic testing to pinpoint the exact gene involved.
Wow, so many ways to get to the bottom of it.
It all depends on your specific situation.
Yeah.
But one thing is for sure, this is just the first step in our deep dive into HCM.
Stay tuned, because we're about to uncover what it's actually like to live with this condition. So we've had our backstage pass to the heart's performance with that echo test, but what happens next? Let's say the results come back and, yep, it's HCM. What's the game plan?
Well, the good news is, for a lot of people, surgery isn't automatic.
Okay, so everyone listening can breathe again? It's not an instant wheel you into surgery situation?
Not at all. Especially if the HCM is mild, or maybe you don't even have symptoms yet.
So what happens then?
Think of it like climbing a staircase. You start with the easiest steps first. Lifestyle changes can make a huge difference.
Oh, here comes the eat your veggies speech.
Well, it's true. Diet, exercise, managing stress, that's foundational.
But those are good for everyone, right? Not just people with HCM.
Absolutely. But they're especially important when you're dealing with a heart condition. For many people with HCM, these tweaks are all it takes to keep things under control.
Makes sense. But what if those lifestyle changes aren't enough? What's next?
That's where medication comes in. Remember we talked about mavacamten earlier?
Yeah, the one that actually targets the root cause of HCM.
That's the one. That's like, instead of just mopping up a spill, you're actually turning off the faucet. Pretty amazing stuff.
Game changer for sure. But there were other medications too, right? Something about beta blockers and
Yep. Calcium channel blockers, those are the heavy hitters when it comes to managing symptoms.
and how do those work exactly?
They basically tell your heart to chill out a little.
Chill out.
Yeah, they relax the heart muscle, slow down the heart rate, and take some of the workload off.
So it's like giving your heart permission to take a break.
Exactly. And for many people, that's all they need to manage their HCM. Of course, sometimes medication and lifestyle changes aren't enough. That's when those more invasive procedures might come into play.
You mean like the septal myectomy or alcohol septal ablation?
Exactly. Those are big decisions, though,
Yeah.
usually reserved for severe cases where other treatments haven't worked.
Okay, so those are more of a last resort, but hopefully a successful one. But before we get into the heavier stuff, I want to circle back to those lifestyle changes. What does a heart-healthy lifestyle actually look like for someone with HCM? We're talking specifics.
More fruits and veggies, less processed food, choose healthy fats, avocados, nuts, olive oil. Basically, what's good for your heart is good for your whole body.
So ditch the donuts and load up on the good stuff. Got it. What about exercise? Are there specific types that are better for people with HCM?
Generally, moderate intensity aerobic exercise is a good bet. Think brisk walking, swimming, cycling. Things that get your heart rate up without overdoing it.
So no intense workout challenges or marathon training without talking to the doctor first.
Probably not a good idea. And even then, it's important to listen to your body. If it doesn't feel right, stop and rest.
That's good advice for anyone, really. Now, we've talked a lot about what people with HCM can do to help themselves, but are there any specific things they should avoid?
That's a really good question. One thing that comes to mind is dehydration. If you're exercising, especially in the heat, make sure you're drinking plenty of fluids. And if your doctor has recommended limiting salt or fluids for any reason, be sure to follow their guidance.
Makes sense. Too much salt can be hard on anyone's heart. What about alcohol? Is that a no-go for people with HCM?
It's best to talk to your doctor about that one. Some people can handle moderate alcohol consumption, while for others, it's a no-go. It really depends on your individual situation.
So when in doubt, check with your doctor. Always good advice. All right, we're getting close to the end of our deep dive here, but we can't wrap up without addressing the elephant in the room, or should I say, the elephant in the chest cavity.
You mean potential complications?
Exactly. We've kind of danced around it, but let's face those what-ifs head on.
Okay, so HCM is a serious condition, and even though most people live perfectly normal lives, it's important to be aware of the risks. We talked about atrial fibrillation, which is where the heart rhythm gets out of sync, and heart failure, which is when the heart struggles to keep up with the body's demands. And then, of course, there's sudden cardiac arrest.
Yeah, that's the one you always hear about, especially with young athletes.
Right. And while sudden cardiac arrest can be a complication of HCM, it's crucial to remember that it's relatively rare. However, it is a risk that needs to be taken seriously, especially for young athletes.
So knowledge is power, but it's also important to keep things in perspective.
Exactly. Don't let fear take over, but don't bury your head in the sand either.
That's good advice for just about anything in life. Well, folks, we've covered a lot of ground in this deep dive. We've gone from those tricky symptoms to the what-ifs that keep us up at night. But there's still more to come.
All right, we're back. We've covered a ton about HCM, from the symptoms to diagnosis, even those wait what moments when we talked about complications. But information overload can be, well, overwhelming.
You're telling me it's like having a million puzzle pieces but no picture to follow.
Exactly. So let's bring it all together. If someone listening today could only take away a few key things about HCM, what would those be?
First things first, don't freak out. HCM is serious, yes, but most people live totally normal lives, especially if they catch it early and manage it right. That's what we're all about here, right? Arming you with knowledge.
Right. Knowledge is power, like they always say. So what else should someone keep in mind? Number two, and I know we've said it a bunch, but family history is huge. If HCM runs in your family, even if it's your third cousin twice removed, tell your doctor. It's like a cheat code for understanding your heart.
Like that family history section on those medical forms suddenly got a whole lot more interesting. Okay, so we've got don't panic and family matters. What else is crucial?
This might sound obvious, but it's important. You are your own best advocate. You've listened to this whole deep dive. You're swimming in HCM info. Now use it. Don't be afraid to ask your doctor questions, and lots of them.
Write them down if you have to. Doctors are amazing, but they can't read minds. All right, last but not least, what's the most vital takeaway for someone navigating the world of HCM?
Listen to your body. Nobody knows you better than you. If something feels off, if exercise suddenly feels different, don't ignore it. Tell your doctor. Get it checked out. Seriously, don't wait.
That's such good advice. We're so quick to brush off those little signs, but our bodies are usually trying to tell us something important.
Exactly. Trust your gut and don't be shy about reaching out to your healthcare team. They're there to help.
Well said. And there you have it, everyone. The end of our HCM deep dive. We've explored the ins and outs of this condition, tackled tough questions, and hopefully empowered you to take charge of your heart health.
Absolutely. Remember, knowledge is power. Keep asking those questions, stay curious, and above all, stay heart healthy.
Couldn't have said it better myself. Until next time, everyone, stay informed.